Good morning, everyone. It's great to be back here now for my third year here at the PCDH19 conference. It's nice to see some familiar faces and to meet some new faces here as well. This conference has been so great so far. We saw yesterday some excellent talks by some physicians and some scientists who have been doing really some beautiful work in the field. So today we're switching gears a little bit, and I'm delighted to start things off by talking, about the PCDH19 Registry, which of course was spearheaded by the PCDH19 Alliance. Specifically, I wanted to start by giving an overview of the PCDH19 Registry, what it is, how it was started, and why. I do know there are some families here who the names aren't familiar to me, so there might not be families who might be less familiar with the registry. So from there, I want to give an update on where we are now as far as enrollment numbers and just some general findings so far. I'll discuss some of the ways in which the registry has been used to date, and wrap up with some plans for the future. But before I start, I just wanted to extend a word of thanks for the families who have participated thus far, who contributed to our paper, which we just put out recently. So this was accepted in December of 2017. We wanted to put something out there, so this really it consisted of all the participants who were in the registry at the time, for whom we had data at the time we wanted to put the paper out. And we wanted to put something out there that focused on what you guys reported as being the biggest concerns. It was really, the behavior, the sleep, because a lot of people had reported on the seizures and the development, but we really wanted to highlight some of the other features to really kind of push some more research forward into what you guys had reported as being some of the issues that you wanted us to focus on. So just a word of thank you for sharing your stories with us so we can in turn share them with the scientific community. Okay, onward. So what is a registry really? So a registry basically, in general terms, collects clinical information from individuals who have a particular condition, really for the purpose of encouraging and supporting research into that particular condition. So the purpose of the PCDH19 Registry in particular really is, it's twofold. First, we wanted to collect both genetic and clinical information to put it into a centralized database. There are many patients out there, and to be able to collect information together and have that information organized into a centralized database is beneficial. And secondly, it would allow us to have a readily accessible patient population that can be accessed for future research in clinical trials. In a way, this exists already with the PCDH19 Alliance, right? You guys kind of already have a group that is kind of centralized together, and there is a way to kind of access the PCDH19 community. But by having a registry, we have something, that's kind of grouped together for the purpose specifically for research and not kind of reaching out to people who are really grouped together for support, but really who are grouped together with the goal of specifically for research and also a patient population that's really carefully vetted for the diagnosis of PCDH19 related epilepsy as well. So we do curate all enrollments into the registry. So we note, for example, when we're questioning whether a particular variant might be disease-causing or not, whether there are other genetic findings that could potentially be influencing some aspect of the clinical picture as well. So these are important factors to consider when describing a patient's variant and phenotype in the context of a research study. So what do we mean by curating curating variants and variant vetting. So Joseph gave us a great kind of description yesterday of what we think about when we're looking at a particular PCDH19 variant, when we're thinking about a pathogenicity of a variant. So I'll just go through very briefly the things we think about when we're looking at a particular variant. So this is what we think about when we're enrolling a participant into the registry, and this is also what we do in clinic as well. So I'm wearing my clinical hat and I see a family come in and thinking about whether this is a particular diagnosis for a family. These are the things that we think about when we look at a PCDH19 variant. We think about previous reports. Has this variant been previously reported in the literature? We also look at a database called ClinVar. So this is a database that all the diagnostic labs use. So whenever they report out a variant, they enter it into this database that's open to everyone to look at. So they enter in the classification of a variant, the date they reported it out as well. So we can see if any other clinical lab has reported a particular variant. We look at population databases. Is the variant present at any high frequency in the general population? We look at those computational or prediction tools to see what they say about a particular variant. We consider the phenotypic overlap and whether it falls within the known spectrum of PCDH19. We consider the inheritance and family history. Of course, knowing that PCDH19 has that unique inheritance pattern, we know that there are some unaffected female carriers, so we kind of put all of that into consideration as well. And of course, any other genetic test results, because we do collect all genetic test reports. So just a brief historical overview. So the PCDH19 registry is housed at both Boston Children's Hospital and at UCSF. So I enroll patients at Boston Children's. NILICA enrolls participants at UCSF. So we started it initially at Boston Children's just to kind of get one IRB approval underway, and then we added on UCSF soon after. We got our IRB approval in September of 2014, and we enrolled our first patient in October of 2014. So we're going on about 3 years, 8 months of having the registry enrolling participants, which is quite exciting. So I wanted to take a moment to outline the current enrollment process for those who might not be familiar. So because the registry is done through a hospital, there are some requirements that need to be met in order to collect the type of information that we want. Specifically, this is the identifiable information. So we want identifiable information because we want to be able to contact families in the future. So we need to get names, date of birth, contact information, and we are collecting medical records too. So there's a lot of identifiable information there as well. So because of that, we need the hospital requires us to have written informed consent. I know that there are a lot of other registries out there that families can just click on a link, sign up online, and that's it. And it's a lot easier than our process. And we recognize that it's kind of burdensome to actually have these pieces of paper. Nobody deals with paper anymore, but we kind of have to do that, unfortunately. So we have these, we need to have written informed consent. So we ask families read and sign a consent form and send that back in to us. In addition, we ask families read and sign a records release form, and that actually allows us to get a copy of the child's medical record from their doctor, their neurologist, the hospital, and also their genetic test report. And finally, we ask that families complete a medical and family history questionnaire, so this allows us just to get some additional information directly from parents, because parents really are the experts. There's a lot of information we can get from the medical record, but it's really the nuances that we can get from families that might not be necessarily in a neurologist note or in a geneticist note that's really, really valuable information. Regarding eligibility, we're offering enrollment to any individual who has a diagnosis of a PCDH19 related disorder, or really anybody who has a variant in PCDH19 that could be related, for which maybe there isn't enough information at the time to know whether it's the PCDH19 variant is diagnostic or not. So we've had some families come to us saying, we have a variant in PCDH19. My doctor isn't 100% sure if it's completely the diagnosis or not. Should I enroll or should I not enroll? Absolutely, we'd love to take anybody, because over time we could find that the variant is diagnostic. Over time we could find that the variant's likely benign. The more information we have, the better. And we'll take anybody who has any type of variant in PCDH19. We're also enrolling anybody in the family who has also been tested and tested positive for the PCDH19 variant. Okay. So moving on to our current enrollment and some general findings. So overall, we currently have 71 people in the registry. So that includes 58 probands. So what do I mean by probands? So probands is usually a term we give to the patient, the person who initially comes for a referral. So consider probands to be the child. So we have 58 children or patients. We have 11 parents, so carrier parents, and then we have 2 additional family members. Of our 58 probands, we have 47 who have a clear diagnosis of PCDH19-related epilepsy. 3 of the 58 have an alternative diagnosis that more completely explains their clinical picture, so they're excluded from this particular analysis. So an additional 8 are also excluded from today's analysis just because there's either uncertainty surrounding the PCDH19 variant being the diagnosis, or there's insufficient data at the time due to either pending records or questionnaire completion or participants being lost to follow-up. So inheritance for our variants in the registry, so 27 are de novo. 7 variants are maternally inherited. Of those 7 maternally inherited variants, 4 of the moms had some sort of symptoms themselves, either seizures early on or some other symptoms. 3 of the 7 moms had no symptoms at all. We have 7 paternally inherited variants, and 6 of the variants are of unknown inheritance. Either only one parent was tested and tested negative and the other parent was unavailable, or for some reason or another, parents were not tested. So here are the variants in our in the registry to date. Sorry if the actual variants are a little hard to see, but just generally the variants on top of the protein are all frame shift or nonsense variants, and the variants on the bottom are all missense variants. So fairly consistent with what we've seen reported. We often see the missense variants being in the extracellular domain. We have a couple of our frequent flyer variants, a couple recurrent variants at position 340, and our frame shift variants at position 366, position 300, so a couple recurrents. Average age of seizure onset across the group was 16 months, which is a little bit higher than older than what we usually see, but I think that there are a couple outliers. So the median age of seizure onset was around 10 months of age, which is I think a little bit more consistent with what we see. A majority of the participants had focal seizures. For some of the others, there was really nothing localizing on the EEG, so the description from what we saw in the records was that of more of a generalized seizure, so we put them in the category of a generalized epilepsy. Response to medication is shown here. So as you can see, while we have about 12 participants whose seizures were well controlled. A majority of the participants had seizures that were still refractory to medication. I don't need to stress that this is an area that's of warranted attention in the research arena. As far as specific treatment, our data did not really yet allow for any specific conclusions regarding which medication works best, which type of medication or class of medication. But there's a lot of data that we have, and based on the data, kind of the information is hard to really tease out. So Nilika and I, when we were kind of going through to pull the data together for our paper, we discussed doing some sort of more targeted follow-up questionnaires where we kind of target the medication questions specifically. Of the 47 probands included, the parents of 10 of them reported no developmental concerns. An additional 12 reported concerns just within the speech and language domain, and 3 with delays in motor skill development. The parents of 20 participants had delays across all domains. So if we look at just those 35 who did have reported delays in development, a vast majority of them did not have any developmental concerns prior to seizure onset. And as you see here, there were some participants that either reached a developmental plateau or experienced a loss of developmental skills. And usually these happen right around the first or second cluster of seizures. I've listed here some of the additional features that were reported in our cohort. So behavior dysregulation was by far the most reported, with almost 70% reporting some sort of difficult or challenging behavior. 13 of the 47 had a formal diagnosis of autism spectrum disorder, and an additional 11 had reported features of some sort of autistic features reported. A few more participants had features that were more consistent with obsessive compulsive disorder. So I kind of put an asterisk here because there are some features that were reported so some features kind of overlap with autism or OCD, so it's kind of hard to kind of compartmentalize between one or the other. So more detailed characterization of these features is warranted to really kind of get to the bottom of what's really going on with some of these kids. And then some more additional participants reported some anxiety and ADHD features. So 26 of the 47 reported some sleep difficulties, which are outlined here. Participants could select more than one response, so sleep was pretty prominent among our group. So just a summary across the clinical features among our participants. So as we talked about yesterday and we saw here, the clinical spectrum is quite variable. This is a very, very heterogeneous population. And as part of the questionnaire that we administered to the registry group, we kind of touched upon, we kind of grazed the surface of a lot of different features, but certainly more targeted information is needed to better characterize certain features, and more in-depth analysis for certain features would be helpful. So how has the registry been used to date, and some of the future directions, and where do we hope to go from here? So we have used the registry to recruit for some outside research studies. We've used the registry to help recruit for several surveys and interviews. I know that Christy Kolk and Joseph Getz reached out to us, and we were able to pass along their survey. We were able to use the registry to recruit for an interview project, which I was working with one of our genetic counseling graduate students. We wanted to get some more information from families from a clinical perspective on their experiences with genetic testing and what providers can do better as far as the genetic testing process. So we're able to do that study. We have a project underway now at Boston Children's that we're hoping to do, bring some kids in for a more formal neuropsychiatric evaluation, and we're hoping to recruit some families through the registry for that. In addition, we're able to use the data that's already housed in the registry. We're able to pass along some of the variants for researchers for various functional studies, for functional analysis. And we've also had some clinical labs reach out in the process of diagnosing other patients and just asking us if we've seen particular variants and just assistance in that realm too. So future directions for the registry. So we hope to continue enrollment and data collection. We hope to up enrollment numbers and get some more, because I think that the power of a registry is really in the numbers and getting some more information and having a larger cohort, I think would be more appealing as a source for data for outside research studies. We had a great meeting this morning, and we've been in talks with Ann Burke, who's here. She's really an expert in natural history studies, and we want to figure out how the registry can work together with a natural history study to kind of really, create a study that's helpful to really characterize this population. And we want to work with a natural history study to so you guys aren't doing extra work, so we can kind of coordinate with them to provide information and data, and also our participants as well, so we can make the transition and the process easier for you guys. We hope to, and I want to get some feedback from the participants in the registry as well. Nilika and I were really hoping to get some clinical updates for the registry moving forward, but we also realized too that, and we're also very aware of, you guys are getting tapped for a lot of, surveys and research studies, that we're aware that participation fatigue is a real thing, and we want to be, aware that you guys are getting asked to do a lot. So. We want get some general updates for the registry, but we don't want to be overburdening to you guys too. So we want to figure out what would be the best way to get that information moving forward too. Okay. So with that, I'd just like to take a moment just to thank our epilepsy genetics team at Boston Children's. And thank you guys for all that you've done to participate in the registry, the PCDH19 Alliance, who's been incredibly supportive, the team at UCSF, who's been co-enrolling the registry with our team at Boston Children's. And with that, I'd love to take some questions and open up for some discussion as well. Thanks.
Questions?
I don't need a microphone. I'm really loud.
Okay.
Can you go back to the sleep mic?
Oh, sure. I did go through quite quickly.
And the study is available on the Facebook group. I'm sorry? The study is available on the Facebook group. Your whole paper is posted there if they want to read it.
Oh, is it?
Yes.
Great.
Yeah.
Yeah, I can hear. Yeah, I think I added 38 in the paper.
I have a question regarding the behavior dysregulation set, because I know when I took it, and just as a parent with a daughter with PCDH19, it's really hard, I think, for me to tease apart behaviors related to, she's on 3 meds. So how do I think about teasing apart behaviors that are side effects of the meds versus of PCDH19. So for further research, I think it might be interesting to dig into like what meds are those kids on and try and see if there's any similarities or how the meds are affecting behavior.
I agree. I think that just getting some more information on how medication is impacting treatment and just kind of getting the nuances of how all these different aspects are interplaying with each other and how behavior is going up and down with medication changes, how seizures are going up and down, and how all of these things are kind of interplaying together, I think would be really valuable information to kind of gather.
Thank you. Thank you, Lacey. I think these efforts are extremely valuable. They take time, and they need patience from both sides to really build this resource. So I would like to ask you the funding, of course, that requires support. And a lot of the registries I know recently struggle with funding because, I don't know, people suddenly don't appreciate how much interesting information can be collected. So one way we have seen, and we have registries, for example, in movement disorders, in cerebral palsies, we're thinking about actually turning these into registries or biobanks, because as much as we share the information, which is extremely valuable, we also need to think about the sharing the tools. And that's another complexity, probably another cost, but when we reflect on yesterday's presentations, we have numerous cell models, stem cell models, which I don't know to what extent, and I'm just thinking loud, would be good to really pull these together with resources like registries to have this information in a centralized way, and it will be able to be accessed by researchers, which I'm sure will potentially can take the research to yet another level. So the continuing of the registries, that's one question. The other one, whether there is any opportunity perhaps to take it into the level of a biobank.
Yeah, so funding has certainly been an issue. So initially the registry was funded by the PCDH19 Alliance for the first year, and then the registry has not been funded for the past 2.5 years. So we've been pulling resources from other funding projects to kind of at least collect the data. So that's kind of put a limit on the level of analysis that we've wanted to do internally. We've wanted to really kind of put some more information out there. There's a lot of information that we have in the registry that we've wanted to do more with. And as far as making it more publicly available, I think that, sharing the registry as, a more publicly available resource, I think that would be something that we'd be open to, and I think that we'd certainly be open to collaborating with other people and making it more available. Certainly.
Anyone else have a question? Thank you very much.